Good morning. This is Dr. Naomi Simon at Mooresville Dermatology Center, and today we're doing a video on what is photodynamic therapy for actinic keratosis treatment of the scalp. Now, photodynamic therapy can actually be used for many different conditions, but we use it most commonly in dermatology for precancerous lesions called actinic keratosis. And a lot of times we use it on areas of skin that don't have much hair but have had a lot of sun over the years, and one of the most common places for that is the scalp in men, as well as the face and the ears. So I have our volunteer patient here with us today, Mr. Stevens. Hi, Mr. Stevens. How are you doing?
Good. How are you?
Thank you for volunteering.
You're very welcome.
And Mr. Stevens has had a many-year history of lots of beach trips. Unfortunately, back in the day, he didn't realize hat and sunscreen was so important, and he's had worn his hair very short, closely shaved for a long time. So that has allowed a lot of UV radiation to get on this head. And so when he came to visit me, we were talking about the sort of rough feeling skin that he had started to notice over the last few years up here, especially kind of mid-forehead and back. And when I took a look at his skin, I could see that he has a number of these little kind of light pink. When you feel them, they're a little bit sandy or rough lesions, 10 to 20 of these scattered throughout the scalp. And so we talked about, Mr. Stevens, that you have a condition called actinic keratosis. And actinic keratosis is the most common form of precancerous lesions, very common in people with fair skin, blue eyes, who've had a lot of sun exposure. And the problem with actinic keratosis is they're not cancerous at this point, but over time they can become squamous cell carcinoma, and squamous cell carcinoma actually can be a fatal form of skin cancer. So we don't just like to leave it there and see what it develops into. We treat actinic keratosis. Now, if Mr. Stevens comes in and he has one or two spots, I usually would just treat them with a different form of therapy called cryosurgery, where I freeze them off. But when patients come in and they have a number of lesions, all in one small area of skin, we talk about doing other forms of treatment, what we call field therapy, treating the whole area. And so we had discussed some other types of treatments for actinic keratosis, what's all available. And you can see that in my other YouTube video about what are actinic keratoses. But we've decided this morning to do blue light therapy. So Mr. Stevens, first thing we do when you come in for blue light therapy is, are you on any new medications, including new antibiotics in the last week?
No.
Okay. And we would want to make sure that we ask about antibiotics, because a few antibiotics, particularly doxycycline and the fluoroquinolones, can make you quite sensitive to light, and you wouldn't be able to have this treatment. So make sure to tell your dermatologist if you are on any new medications. And Mr. Stevens, what's going to happen after this treatment is you'll have to stay out of direct sunlight in the area that was treated for 48 hours. Are you okay with that, or are you heading to the beach this weekend?
No, we're not going to the beach.
Okay. So I think we're good. We're going to go ahead and show you how we apply the medication, aminolevulinic acid, to his scalp. And what I do first is I mark out the area to be treated. And we like to treat kind of, a bit far down onto the forehead here, where we see areas of sun damage. And how we know areas of sun damage, basically the red areas, which are the actinic keratosis, as well as brown sun freckles there. Now, what I like to kind of use as an example to patients as to why we need to treat a whole area is kind of like if you imagine the skin as a flower bed. What you can see to the naked eye with the actinic keratosis are like weeds maybe sticking up out of the mulch. You see maybe 10 or 20 of them. But what you don't see are all the weed seeds down there under the mulch that haven't bloomed yet. So when we treat in this way, we're getting all the spots that have precancerous cells or DNA mutations from the sun that haven't even come to the surface. That's why this is a great treatment, because it's going to help give him smoother, clearer, actinic keratosis-free skin, hopefully for many years. In some cases, patients need several treatments with blue light, once a year or a couple of times a year to get clear. But what I found is if people will go ahead and do that and treat their actinic keratosis for several years, usually they don't have nearly as many coming back when I see them back again. Okay. Okay, so what we're going to do now is go ahead and apply the medication.